All right, time for the daily briefing now. Wednesday, July 8th, in week 18 of Cordova's response. Things are getting a little more interesting here of late with the identification of a third case in less than a week. And we're going to get into that with Dr. Sanders, of course, and Mayor Koplin, who's also joining us. Talk a little bit about what it means and some suggestions for how to respond. This program, as I'm sure you probably know, is on the air in the 1 p.m., 5 p.m., and 8 p.m. hours on the radio, and then it goes online to youtube.com/Cordova TV. So let's see what our local team members have to say about the latest news here. Dr. Sanders, Mayor Koplin, glad that you can be with us as things go from that lull that we seem to be able to enjoy for a while to getting a bit more active. And I actually have the news release that came out from the city. It says Cordova's medical response team has identified a positive result found in screening, the third positive test for Cordova. The state has been notified. Contact tracing has begun. As more information becomes available, we'll let City Incident Command know as appropriate. So that's obviously thin on detail, but we have to be very careful, and I totally support not drilling down too far as to be getting into somebody's personal life. So what do you know maybe since this release came out, or what is okay to share as far as this now third case identified fairly recently?
Well, we want to, just as you said, we really want to ensure that we're protecting the privacy for any of our individuals when they test positive. That is very important. With this case, it is very widely known, and city officials have agreed that we will share that the individual does work at the city center. And in an abundance of caution, the city is going to decrease people going in and out of City Hall. They're going to close the area where the individual worked for 3 days for cleaning and ensure that we're keeping the community and the employees there safe.
Okay. And Mayor, anything to add to that?
No, I agree. We just want to keep the community informed. We realize there's a lot of rumors flying and want to provide timely information, but also accurate information. So there will be more to come. But as people see coming and going or reduction of it, this will provide a little background for that.
Okay. And I assume that the city has a response plan like every other entity is supposed to have and hopefully does have. Are these actions being taken, Mayor, in keeping with that plan?
Yes, I think Dr. Sanders really characterized it well out of an abundance of caution. Mm-hmm. So as conditions dictate, the plan elements are being followed and in some cases exceeded as necessary to just assure that we keep things under wraps. So abundance of caution is a good term. Okay. And I think it's a good reminder to all the organizations in the community that you've probably filed your mutual assistance plan with the city, and need to remind yourselves and your employees of that. It's one of the things that we can all do to help keep the community and our employees and our citizens safe. So good to remember the elements of those plans. And an important one that can really help our medical team is if you do have an employee that becomes symptomatic, remember that they shouldn't go straight to a testing station, that they should call their medical provider or the Alaka Clinic or CCMC and talk to a medical provider so they can walk through those symptoms and schedule the appropriate response, whether that's testing and when and where that will be administered. So just wanted to remind of that as well.
Okay. And Doctor, that's a concept that you've been reinforcing too. A question that you get a lot has to do with our testing capacity and is it still good? And generally what you've been telling me is yes, but. So let's go over that again now, when to come in to be tested and when not to.
So if somebody's having symptoms, we want them to call their provider so that we can determine if they need an additional evaluation as well as how to get the testing done. Some of our testing, we have people socially distanced but waiting around others. If somebody's having symptoms, we do not want them waiting even in an outdoor space around others. So that's part of the reason we want to schedule those tests individually. For other people, we want to provide testing after travel. So in-state or out-of-state travel, we're recommending a baseline test and then a repeat test at 7 days. Some critical industry have plans for testing in their continued work in their work plans. So we want those individuals to come to walk through testing. We also want people to come to walk through testing for the pre-appointment for dentist or other doctor's appointments. Aside from those uses, having individuals randomly get tests doesn't offer a whole lot of increased safety for our community at this point, and is overutilizing the test supply. We do have a good supply of tests when they're appropriately used. We don't have enough for people to do frequent testing just for that personal reassurance without an exposure risk. Our supply and the supply chain is just not that robust at this point to have individuals doing repeat testing in that way.
Okay, so the kind of just for the heck of it testing threatens our supply and ability to keep the testing just sort of available for everyone, as we discussed yesterday. If it does, if the supply should get run down at a certain point, it's going to have to be regulated a little more carefully and only for designated individuals, right?
Yes. The other thing that will happen is we'll have to utilize send-out tests, and the turnaround time on our send-outs are several days. I think the most rapid one that we have is 4 or 5 days right now.
Okay. Now, of course, Doctor, the rumor mill, which we do know is running a bit on overdrive right now, but that of course is a symptom of worry. People start to hear there may be community spread, there may be cases at certain, and we can't address all of those. But as far as the general sense of worry, people that are thinking, what am I supposed to do now with more cases appearing? How would you address that? How should people respond individually to the news that's been coming out over the last few days, as far as the virus becoming a little more present here?
Well, now we know it is in Cordova, and people can contain this by their own individual action. We have seen a lot of data coming out recently regarding wearing masks, and that wearing masks does decrease transmission of COVID-19. Cordova acted very early with our mask rule, and people have been compliant with that rule. We want people to continue using masks. It's a really important tool that we have. And just to be cautious with your behaviors and protect the more vulnerable populations around us.
Okay. And earlier this morning, when we were trying to find a good time to visit and create this program, you gave me the idea to create some space on one of our Facebook pages and an email address for people to send in questions that, when you're on with me, that we might be able to toss your way. Not as a replacement for the Cordova Prepared program, but just, things to address on the radio. And somebody did respond to that and was asking, in light of the rumors, how would somebody know if they came into contact with a positive person?
Our contact tracers in Alaska and here in Cordova we have a robust system. So as we go through that contact tracing, individuals will be contacted and notified if they are identified as a contact and need to go into quarantine and or be tested. The CDC defines a close contact as anybody that is within 6 feet of an infected person for at least 15 minutes within the 48 hours prior to illness onset, or for the asymptomatic individuals, the 48 hours before we obtain the positive result. When people are identified as one of those contacts and you're contacted and told that you were in contact with a positive patient, we ask that they self-quarantine, self-isolate for 14 days. So that 14 days starts from the time of the last contact with the individual that's positive. We do recommend sometime in that period having the individual get a test. We would prefer if they would call and let us know if they're going to come to the walkthrough testing or drive-through testing. We will ensure that that individual, that we can collect the test in a more socially distanced way, and we don't have them waiting with the testing group.
Okay.
But
go ahead.
The big deal there is those contacts need to isolate for 14 days. The CDC recommends a time-based strategy for these contacts, so they do not require a test at the end of the 14 days in order to get out of isolation. You just wait the 14 days and then you're done. And as long as you didn't develop any symptoms, you can go back to our new normal, which is regular activities with social distancing and wearing a mask.
Okay. So the main thing then, in answer to that question, how does somebody know if they came into contact with a positive person? It is that person would be identified through the contact tracing, which in Cordova we have every reason to expect is going to be a powerful system, that they would be contacted and then given instructions.
Yes.
Okay. Mayor, as you're listening to this, I guess kind of the same question for you from your position as a member of the team, as an elected official. What are your thoughts about how you would encourage the public to respond to this news?
First of all, just to kind of circle back to frustration, the public's frustration about information and the timeliness and the anxiety that comes with that. Just remember that incident management teams, first responders, even electric utilities, during an outage or a fire, an emergency is when those staff are most busy. So ironically, that's when you want to call and get quick information. Why is my power out? So forth. That's right when you probably have all of your staff really busy working on the power lines and generators and so forth. So that's sometimes a difficult time to provide immediate information, and certainly difficult to provide accurate information. So a little patience on the public's part helps, and that's a good segue into what we can be doing, which again is following those plans, following our social distancing and masking and sanitation guidelines. I will say I was a little disappointed to see the large groups and very close proximity over the 4th of July weekend. I just would reiterate Dr. Sanders' comments earlier. We know that it's in Cordova now, so just continue to following those guidelines that we know will work to protect yourself individually and also your coworkers, friends, and community. So we would continue to encourage that.
Well, and it's true as well that if anybody is particularly concerned about community contact, especially if there's a vulnerable member of those vulnerable populations in your household, the elderly, the immune compromised, and so forth, even if there isn't any sort of sweeping mandate that shuts businesses down and only allows curbside delivery and says stay at home as much as possible and all of that, people can still choose that more defensive position for themselves, right?
Exactly, and that's a great thing about Cordova. We've done great so far. We started early, so that can wear our patience a little bit. But I just had a neighbor ask for a hand with a completely unrelated medical issue. Just needed help with a family member, and you just walk over and give a hand. And that's what Cordova is really great at. So we can certainly make our own decisions and manage our own behaviors to keep ourselves and our families safe.
Okay. So, Doctor, again, to circle back to this latest case, you say the best thing for folks to know is that the contact tracing is underway. We have every reason to believe it's a good system, and that anybody who might be impacted will be contacted. Is that the gist of it?
Yes, that's accurate. We will get in touch with you.
Okay. Anything else kind of in closing here?
No, I think if everybody can take a deep breath and know that we are working very hard to make sure that we get the contact tracing done and keep the community safe, as well as provide testing as frequent and open as we can, but asking people to really check with the providers and trust the nursing staff and physician staff when they provide that guideline to maybe wait on the testing, or when they suggest somebody doesn't need it at that time, to listen. We have very valid reasons for determining the timeframes that we do the testing. So just everybody cooperate with the local healthcare staff. They're working really hard to support Cordova's needs.
Okay, Mayor, last word.
Yeah, I just like to reiterate how fortunate Cordova is to have a really great medical team that works together and is really well connected with the state and directly collaborating with them as well. And just a last piece I would share is that the website, COVID-19 website, is updated with bulletins that are accurate. They've been vetted, and it's a great way to circle back. And of the first two of these three cases over the weekend and so forth, you can get more details, but also suggestions for how to respond appropriately. So just remind everyone that we've got a hardworking team that keeps somewhat timely but accurate information available on the website there.
All right. Well, it is a good asset. 424-INFO is still out there. 424-WELL is still out there. And we thank you both for your time here and your information. Hope it was helpful to folks. Okay, that's a wrap for today's Daily Briefing, July 8th. Remember, if you joined us late, it will be coming up 3 times on the radio and, more importantly, available on demand. YouTube.com/Cordova TV. It's usually up there by about 1:30 in the afternoon, give or take. So if you want to be able to listen to it again, listen to it more slowly, pass it on to somebody else, that's fine. Monday through Friday, 1, 5, and 8 p.m. hours, and youtube.com/Cordova TV is where you'll find these. Again, remember, covid19.cityofcordova.net is an excellent city resource, as is that phone number 424-INFO and 424-WELL. We'll continue to keep you posted as things develop here, and we thank you for joining us. We'll get you back to regular programming on the Clam and the Eagle.